Hi, welcome back. So we're going to cover chapter 4 on health promotion. Health promoting behaviors are important to learn because they're related to at least one major cause of illness and death. Health promoting behaviors are exercise, accident prevention, cancer prevention, healthy diet, and sleep. Statistics show that over 2/3 of American adults do not engage in recommended levels of exercise, and 2/3 don't engage in any leisure time physical activity. Studies show that there are certain demographics of people that tend to exercise more than the average. For example, individuals that are male, Caucasian, younger adults have higher SES and come from families that exercise regularly tend to exercise more. Those who also have positive attitudes towards fitness, are high in well-being, have the social support to exercise, and have a sense of self-efficacy tend to exercise more than others. There are many benefits to exercise. So for example, exercise helps with weight control, strengthens bones and muscles, improves and maintains mental health, improves sleep, promotes the growth of neurons. So that means it could actually increase cognitive functioning, decreases resting heart rate and blood pressure, and it can boost the immune system. There is some evidence showing a link between exercise and stress reduction. Exercise also helps with wound healing and reduces the risk of chronic diseases. These include cardiovascular disease, diabetes, and some cancers. Gomez, Pinilla, and Hillman did a study on exercise and cognitive abilities, and they found that exercise significantly improved cognitive functioning. Aerobic fitness spares age-related loss of brain tissue during aging. It increases information processing, helps with attention and task performance, and also has beneficial effects on planning, memory, and higher order reasoning. There is a significant strong link between exercise and mental health. For example, studies have shown that exercise tends to improve mood and self-esteem. It has been used as a treatment for depression. It improves sense of self-efficacy, reduces stress, and has economic benefits. So for example, it reduces healthcare costs. It can increase job productivity and satisfaction. Two common types of exercise are aerobic exercise and anaerobic exercise. Aerobic exercise means with oxygen. So when you participate in exercise or activity, it increases your heart rate and your cells use oxygen to produce energy. So aerobic exercises are marked by high intensity, long duration, and the need for endurance. High impact aerobic exercises are high level of intensity, feet leave the ground simultaneously during the workouts. Low impact aerobic exercises are low impact cardio, so this would be swimming and cycling. Anaerobic means your body does not use oxygen to produce energy. Anaerobic includes short, fast, high-intensity exercises. This would be strength training and weightlifting, and high-intensity interval training. The recommended amount of exercise for normal adults is 2.5 to 5 hours a week of moderate intensity, or 1.25 to 2.5 hours a week of vigorous intensity. It is recommended that older adults take short walks or just increase activity level. This can have physical and psychological benefits, even when it's not vigorous exercise. Any physical activity is better than none at all. There are several barriers that adults have reported that keep them from exercising. This would include the lack of time, stress, illness, fatigue, having a busy schedule, lack of safe places. So especially for people that live in a low SES environment, there might not be places to get physical activity. There may not be gyms nearby or places to work out. And so this has a lot to do with accessibility as well. There may be neighborhoods where people don't live nearby a fitness center, and so this can be a barrier to getting exercise. Factors that can promote exercise are convenient and easily accessible settings, such as sidewalks in the neighborhood and fitness centers close to home. Less crowded areas can also increase the likelihood that somebody would be motivated to exercise. Safe places, improved environmental options such as walking trails or rec centers, and social support. So being encouraged to exercise has actually shown to increase the likelihood of someone exercising. Accessibility, social support, environmental resources, safe neighborhoods, and individual characteristics are all predictors of exercise. So for example, someone who has high self-efficacy, extroversion, and positive attitudes towards fitness are more likely to exercise. Studies have shown that the best predictor of exercise is getting regular exercise. So people that have a set schedule on when they're going to exercise and do so regularly are more likely to continue that trend. Regular exercise involves long-term practice. So this means embedding exercise in daily activities, developing a regular exercise program, which can become automatic and habitual. And so a lot of predictors of adherence to regular exercise would be convenience, participating in activities that we like, motivation to pursue exercise, and a belief that physical activity is important. And so, for example, someone is more likely to exercise regularly if they participate in certain types of exercise that appeal to them or that they like. And so they may be more motivated to then keep exercise in their daily regimen. Exercise interventions are important because they can promote general lifestyle changes for exercise. The interventions incorporate principles of self-control and help people form implementation intentions. The goal of the intervention is also to increase people's motivation to exercise. Effective mental contrasting is a technique in which you contrast your current mental state with imagined effective states that would be achieved with exercise. Promoting personal values can also increase the chances of exercise. So for example, increasing positive values of exercise and the desire to be fit. Several types of interventions for exercise are family-based interventions. Sometimes it helps to increase a person's chance of exercise and promote that health behavior change when helping family become more active and involved in the person's intervention. So helping induce all family members to be more active can be successful in terms of increasing the chances this person exercises. Relapse prevention techniques can increase long-term adherence to exercise programs. Many of these interventions try to identify the strategies to overcoming barriers. And barriers predict maintenance. So the less barriers there are, the more likely the person will maintain their health behavior. Interventions can involve multiple health behaviors. So this can promote change not only in exercise, but in other health behaviors. Motivation to engage in one behavior can encourage motivation to do another. So for example, if an intervention involves trying to get somebody to motivate themselves to go to the gym, if they go to the gym, chances are they're also going to be more likely to sleep better. They may be more likely to diet or change their diet in a way that's healthier or manage stress better. Exercise in the US has increased in recent decades, and physicians are increasingly advising their patients to exercise. The number of people who exercise has increased by more than 50% in the past few decades, and this includes sedentary adults, the elderly, and chronically ill patients. The older adult population is getting greater, and despite this, more people are exercising and living healthier compared to past generations. Fall-related accidents are a common cause of death and injuries in older adults. An estimated 28,000 older adults die each year of fall-related injuries. It's also a cause of death and disability among children under age 5. Some strategies to reduce accidents are interventions for children, such as safety catches, gates, teaching safety skills through games and websites. Interventions for older adults consist of taking medications, physical activity training, making small changes in the home, and fall prevention programs. Medications are to help reduce bone loss, which can reduce the risk of a fracture if somebody falls. Physical activity training includes balance, mobility, and gait training, which reduces the risk of falls, and making small changes in the environment, such as having better lighting, non-slip bath mats, shower grab bars, and handrails in homes are helpful and effective. Motorcycle and automobile accidents are the greatest cause of accidental deaths. Typically, it's because there's a lack of seatbelt use, texting and driving, and social media on phones, and that usually is a predictor of an accident. There are preventative measures. For example, social engineering solutions can help educate people on speed limits and wearing seatbelts. Some psychological interventions would be to increase motivation to practice safety and addressing factors associated with accidents. For example, reducing cell phone usage while driving, being mindful of the speed at which people drive and the way people drive. Mammograms are recommended every year for women ages 45 to 55 and every other year ages 55 to 74. It's important for older and high-risk women to get mammograms due to the prevalence of breast cancer. It's also very cost-effective, and it improves chances of survival if cancer is detected early. Usage declines with age due to fear of radiation, and so many women feel that if they're exposed to radiation, they could actually increase their risk. However, this is not the case. And so it's strongly recommended to get these screenings every year once you reach the age of 45. Other barriers to cancer screening procedures are having embarrassment over the procedure, anticipated pain and anxiety, or fear that results could be positive and they may have cancer. So this is more about avoidance behavior, concern over costs, and lack of awareness, time, and resource availability. Some measures to promote screening are changing attitudes through interventions and improving social support. Colorectal cancer is cancer in the colon or rectum, and it's the second highest cause of cancerous deaths. Participation in screening is predicted by self-efficacy, which is the belief in the ability to maintain good health, perceived benefits, which are your perceived pros and cons of doing it, physicians' recommendations, social norms favoring it, and certain barriers. Community-based programs that use the mass media, community-based education, interventions through social networks such as churches, healthcare provider recommendations, and reminder notices can promote participation in cancer screening programs. They can attract older adults. There's telephone-based interventions that are tailored to people's resistance to colorectal screening, which can increase the likelihood of obtaining screening. Hispanics are at a particular risk for colorectal cancer, so it is especially important to reach them. The past 30 years have seen a nearly fourfold increase in the incidence of skin cancer in the US. So measures to promote safe sun practices are educational interventions. a lot of these cancers are the most preventable. And so when people have excessive exposure to ultraviolet radiation, it can increase the risk of skin cancer. Also, living or vacating in southern latitudes or participating in outdoor activities and using tanning salons can all contribute to dangerous sun exposure. There's also a statistic that less than 1/3 of American children protect themselves against the sun. And so as a result, health psychologists have tried to develop interventions to promote safe sun practices by educating others, using interventions that help people gain knowledge about the risks of skin cancer and the effectiveness of sunscreen use can reduce the risk. Effective sunscreen use requires knowledge about skin cancer, perceived need for sunscreen, the perceived efficacy of sunscreen as protection against skin cancer, and social norms that favor sunscreen use. Communications to adolescents and young adults that stress the gains that sunscreen use will bring them can be more successful than those that emphasize the risks. Diet is an important and controllable risk factor for many leading causes of death and disease. Diet is related to serum cholesterol level and to lipid profiles. The dramatic rise in obesity in the US has added urgency to this issue. Only 13% of adults get the recommended servings of fruit, and only about 9% get the recommended servings of vegetables each day. Dietary change is critical for people at risk for or already diagnosed with chronic diseases. It's difficult to get people to modify their diets. However, even when they are at risk for certain diseases like cardiovascular disease, or their physician recommends it, they may still have resistance to changing their diet, or they may not do it. The typical reason that people switch to a diet that's low in fat is to improve appearance, not to improve health. And so even then, fewer than half of US adults are meeting the dietary recommended requirements for reducing fat levels and for increasing fiber, fruit, and vegetable consumption. A healthy eating pattern includes a variety of vegetables from all subgroups. This includes dark green leafy vegetables, red and orange veggies, legumes, starchy veggies, fruits including whole fruits, grains, fat-free or low-fat dairy, and a variety of protein foods. So this includes seafood, lean meats, poultry, eggs, legumes, nuts, seeds, and soy products. Predictors of food choice include social norms, taste, cost, and time. Social norms can influence the decisions about how much food we eat and the tendency to eat when others around us are eating. Taste is driven by hedonic eating, which is pleasure driven, and also convenience and obtainability. And so if we are in an environment or in a neighborhood that does not have access to healthy foods, we are going to select foods based on what is most convenient in terms of location. And so people that eat healthier tend to be nearby healthy food stores or grocery stores, whereas those who are more likely to eat fast food are more likely to be near fast food places and restaurants. There was a study that was done in 2012. It was a qualitative study of beverage consumption among college students. 12 focus groups were conducted in 6 colleges, and students were given a brief anonymous survey. They reported their demographics, height, and weight, and which factors determined their choice of beverage. And the results showed that taste and price were the most important reasons for choosing a beverage. Another study that found taste, convenience, time, and price determined healthy eating was based on a Brown study. They conducted an intervention involving vending machine sales on college campuses. College students tended to select quick, tasty, and readily available food options because convenience, taste, time, and price are prioritized over nutritional content. And so people are more likely to select healthier food options when they are highly obtainable, affordable, convenient, and taste good. High food security, more health-oriented food products found in high SES neighborhoods tend to predict healthier eating. Another study examined college students' eating habits and knowledge of nutritional requirements for health. About 66% of students indicated they had consumed processed food every day or more than once a day. About 89.3% of students had reported they were aware that processed food is unhealthy. However, a high level of knowledge of healthy foods does not predict healthy eating. Even if motivation to eat healthier is there, access to healthier food options may not be. Diets tend to be restrictive, monotonous, expensive, and hard to implement, which reduces the adherence rate to modifying a diet. They're also time-consuming because they require changes in shopping, meal planning, cooking methods, and eating habits. Studies have shown that people have a preference for high-fat foods, and comfort foods tend to be high in fat and sugar, which can lead to poor dietary habits. And so interventions need to be implemented in terms of how to increase adherence to modifying diet and also removing some of these barriers such as time consumption and inconvenience. There is a significant correlation between stress and diet. Stress has a direct and negative effect on diet. Stressed people are often more distracted, have less self-control, and may not pay attention to their diet. In terms of stress among university students, over 50% of students report high levels of stress. Major causes are academic workload and time management, and they're correlated with compromised quality of diet. A healthy diet requires a strong sense of self-efficacy, knowledge about dietary issues, family support, and the perception that dietary change has important health benefits. So a person that has a strong sense of self-efficacy, meaning that they have a strong belief that they're able to make those changes, and higher levels of knowledge about dietary issues as well as family support are more likely going to make those changes. A person that has a high level of perception that dietary change can provide them important health benefits are also much more likely to control their diet and make the necessary recommended changes. Most diet change is implemented through cognitive behavioral interventions. Efforts to change diet begin with education and training and self-monitoring. Most people are poorly informed about what a healthy diet is and do not pay attention to what they actually eat. Additional components are stimulus control and contingency contracting, coupled with relapse prevention techniques for high risk for relapse situations. Drawing on social support for making a dietary change and increasing one's sense of self-efficacy are two critical factors for improving diet. Self-affirmation and motivational interviewing have also shown to be helpful in getting people to increase their fruit and vegetable intake. Training in self-regulation includes planning skills and formation of explicit behavioral intentions that can improve dietary adherence. Implementation intentions regarding exactly when, where, and what food will be consumed can also help people bringing snacking under intentional control. Much eating and snacking tends to occur mindlessly when people are exerting little self-control. So for example, just seeing other people snacking can increase a person's likelihood of also doing so. In such cases, simple environmental interventions such as a sign in a cafe promoting healthy eating can help people make good choices. Recent efforts to change the dietary habits of high-risk people have focused on family interventions. Eating meals together promotes better eating habits. So in family interventions, family members typically meet with a dietary counselor to discuss ways to change the family diet. So when all members are committed and involved and are participating in dietary change, it is a lot easier for a target family member to do so. Children who are involved in these interventions may practice better dietary habits into adolescence and adulthood. So, for example, an intervention with Latina mothers with type 2 diabetes and their overweight daughters made use of this strong social tie to promote weight loss and healthy eating. Community interventions that are aimed at dietary change have also been undertaken. So, for example, nutrition education campaigns in supermarkets have shown some success. Tailoring dietary interventions to ethnic identity and making them culturally and linguistically appropriate may achieve particularly high rates of success. Social engineering, such as implementing access to healthy snacks in schools and workplaces, have also been successful in changing or modifying diets. Also, making unhealthy fast foods more expensive and healthy foods less so can help improve diet. Researchers are moving towards interventions that are more cost effective to alter behavior related to diet and exercise rather than large scale CBT interventions. And so a lot of these interventions may seem heavy handed because most people eat what they want based on their preferences or what is available, and it's very hard sometimes to remove the barriers, but nudging people in the right direction through subtle messages may be very effective.